Now, home health agencies have need to be able to market their business to referral sources and to the public. We need to be careful on how we create our pay structures for our current marketers and our current liaisons out there. So as marketing practices becomes more popular and is definitely needed, your agency should be trained and your management should be trained to orient your current marketing team, your liaisons, your salespeople out there. We need to make sure that they are trained properly so that they do not break any laws that cause problems for your company and your agency. So as marketing practices becomes more popular, we are starting to see people hiring salespeople with experience outside the arena of the healthcare industry. So these employees that we're bringing in are good to bring in, but at the same time is this: they are working for unregulated business environments, and they definitely require and need the education on the rules and requirements that governs the healthcare industry. As home health owners, administrators, director of nursing, CEOs, or managers, many marketing people out there or techniques used in the outside world, outside of the healthcare industry, can land a healthcare provider in the hot waters, even in jail. To add to this, employment law requires and requirements for minimum wage and overtime set specific rules for those outside salespeople. And we definitely need to make sure that we completely adhere to them. Violations of any of these laws can be costly for your company. We will discuss several things about this area. The first one that we're going to discuss is the problems with paying for referrals. So let's go ahead and start this. Whether you entitle yourself a salesperson, a marketer, a liaison, when we bring in people outside of the healthcare industry, these salespeople and marketers from non-healthcare business fields, they traditionally receive their payments in the form of what we call a commission or a draw against commissions. In other words, they are pretty much paid or receives payment on the basis of the sales that they produce. Now, in the healthcare industry, sales are generated through referrals from other healthcare providers or direct solicitation of the patients. A strict prohibition against any payments, any solicitation of payments, or receipt of payments for a referral of a Medicare or Medicaid business. Let's discuss this again. The Medicare and Medicaid Anti-Kickback Act specifically prohibits whoever from knowingly and willingly soliciting or receiving any remunerations. If one purpose of the payment is to induce a referral of business reimbursed under the Medicare and Medicaid program, this law therefore impacts how we pay our marketers, how you pay them for those referrals that are generated, and also raises concerns on any traditional business perks your marketers may choose to offer referral sources. So let's talk about that. You may be paying your marketers correctly under your eyes and from what you see, but if your marketers on in the other end of things, in the back end of things, is paying those referral sources, because the more that they get, the more they can keep their job and gain more bonuses, more money. You are still violating the law because they're your employee. You need to make sure that you have policies and procedures in place, okay? As well as coaching time and in-services, and that your marketers are signing a contract stating that they are aware of the anti-kickback statute and that they will never, ever do anything that will compromise or violate it. Now, similarly, the HIPAA law, or what we call the Health Insurance Portability and Accountability Act, also includes prohibition against the use of gifts, as well as any other benefits to directly solicit any patients for services. Now, having these two laws can incur jail sentences, huge fines, and mandatory exclusion from any government programs out there if you are violating these. It is so clear that payment of a commission or even a sizable bonus to your liaisons, to your marketers, has expressed an exclusive purpose of inducing a referral for a home health business, much of which is reimbursed by the Medicare or Medicaid program. As such, those commission payments to your marketers violate the plain word of the Anti-Kickback Act. In addition to this, in the business world, salespeople often market to their prospective clients for lunches, ball games, or any other perks, golfing outings. Those business tactics outside the healthcare industry is prohibitado. It's prohibited, and it's not supposed to work in our industry. And we need to train them and show them and let them know the rules that cannot be done in our industry. We need to educate them. That is your job to do this. Over here at Home Health Success Academy, we can definitely help your company to be able to create a payment structure in order to make sure that you are within the law, that you are not violating any law out there that could put you or your team, your company and organization, your money in harm's way. So, now, commission payments are protected. Employers should be concerned about and need to have and make sure that they are alerted to certain areas, that their marketers, their sales practices on a day-to-day basis are monitored. When you hire someone, each of your employees should always be instructed on the prohibition on the Anti-Kickback Act. When I hire new employees, new marketers, or any other new employees, that is one of the first things that I will orient them on, so that they are aware of the Anti-Kickback Act, and they are required to review sign a code of conduct agreeing not to offer any kickbacks. That's right, including the person that answers your phone call. Yes, including those HHAs of yours. Yes, your nurses. Yes, your therapist. Even your janitor. It does not matter who you hire, they all have to sign that conduct agreement. They all have to agree that they will not offer any kickbacks to anybody. They all have to sign that contract. They all have to agree that they will not offer any kickbacks to anybody. Okay? It is unlikely that the OIG would prosecute for a single lunch or a box of donuts. The literal language of the Anti-Kickback Act prohibits such conduct, but at a minimum, this requirement establishes a pattern of supervision that should be supplemented with regular performance reviews and ongoing supervision of activities. Countless times, agency owners, CEOs, presidents of these companies do not even know a single thing that their home health marketers or liaisons or salespeople are actually doing out in the field. You need to be able to monitor them. You need someone that needs to do this on a daily basis, a weekly, a monthly, and a yearly. We actually offer that program, is that we actually go out there and get hired to monitor full marketing teams. And you should have somebody that is going to be working for you full time. Whether us or you hire somebody who is in charge, okay, they need to make sure that they monitor your marketers out there. Look, your marketers needs to bring in the right type of marketers, okay? And you need these patients to come in order for your company to continue on. But if your marketers are doing it wrong, you may close your agency down. You need to know what's going on in your company and outside your office. You need to be able to make sure, and it is very important to know that agencies should always scrutinize and identify any and all marketing costs, including the wages paid to marketers, to assure that no such costs are claimed under the annual cost report. Marketing cost is not allowed in the cost reports, and any claims for such costs could be constructed to be a false claim. Another thing to look into when you're out there hiring your marketing team and paying them, one of the biggest hurdles that you may face is structuring a marketing payment plan that will be considerable. Okay, that'll be considered, or it's in consideration or requirements for the minimum wage and overtime liabilities. Okay? As a quick overview, employers should and must pay overtime to employees for all hours worked in a work week if there's an excess over 40 hours, unless the employee is a properly classified exempt employee. Overtime pay is to be calculated 1.5 times the employee's regular rate of pay. Hours worked include every time an employee has suffered or permitted to work, including paperwork and travel time, other than to and from the work site. The use of an approved only overtime policy is pointless and without effect if the employee's job duties requires him or her to work an excess of 40 hours in a work week. A commission payment system encourages marketers to be out in the field, pounding on the doors, knocking into the physician's office and into the walls if they need to, so that they can go in and be able to get you guys more referrals. Thus, there exists the one risk of overtime pay, unless those marketers is properly assigned and classified into an exempt job duty status. So remember that. Make sure that you look into this, that you are able to properly assess, and you want to be able to make sure you can classify them into that exempt job duty status, okay? One of the biggest problems that I personally have faced, or what I've heard from the outside, is how much do we pay our marketers? This can be very tricky because it depends on where you are currently at. Where does your home health agency reside? Which state? Which region? Which part of the country? So I don't want to be able to give you a specific number, but I will go ahead and explain to you how I've done it in the past. I always make sure that I start my marketers, my liaisons, at a low tier. When you hire a new marketer, never give them the highest tier because you don't even know how much or how they can actually produce out there for you. I've made this mistake in the past, and I don't make them anymore. So as you need to know, you need to see first what your marketer can do in the field, and if they can prove themselves to you. That they need to be able to make sure they do everything legally, properly, and to be able to submit the forms needed on time. Then you can determine if they're worth the higher rate. You need to check first within the first 3 months, and don't even make that mistake to get the high rate automatically. Now, if you want to be able to create a structure for your payments, we have a free video online in YouTube, or give us a call and we will definitely go ahead and speak to you and forward you the video that you need to be able to use in order to create that payment structure for your employees. Look, as a liaison, one of the things I teach when you're hiring a marketer out there, and we will actually go over this in another set of videos as we go on this video series, what we do is literally this. You don't need to hire yourself a marketer that is actually a nurse. Because if you hire yourself an LPN or an LVN, as they may call it in the California area, so if you hire an RN, an LVN, or an LPN, what ends up happening is that you're going to have to pay them at a higher rate. And it really goes against everything that I believe in regards to starting them off low. Look, you can start them off low and they can prove themselves within the first 3 months. But if they cannot deliver what they promise or what they say they're capable of doing when you create and start the interview, then you're going to have to cut your ties with them, or maybe readjust your salary option that you guys have made with them. But the first 3 months, they need to be able to prove themselves. And at the same time, as like I said, watch our video online on YouTube that's going to be able to detail to you guys about how we handle the pay structures. Look, it is very important to have marketers. as an agency, your agency is not going to be able to function unless you have somebody out there marketing your company. You can't just expect the phone to ring or patients just going into your doors. It's not going to happen. Somebody's going to have to go out there constantly, 5 days a week, pretty much the whole year. If you don't have a full-time marketer, your administrator or DON should be doing it right now. And you know what? For an agency to be able to be successful, somebody should be out there really every day, literally opening about 60 doors the minimum in a week time to be able to meet people. If you have any more questions, we have more videos coming for you. I just want to say congratulations and keep on watching.